So I'm going to say end of day 2, right there. So just so you have some understanding, I've been in the hospital for 4 days. Today is day 3. If you didn't see day 1 or day 2, go ahead and check them out because I guarantee you missed something. Absolutely you missed something. Most of everything that happened was in day 1 and day 2. So definitely check those out. I know they're a little lengthy, but you know, there's some good stuff in there. Other than that, enjoy day 3 and I'll see you for day 4.
It's interesting. They took my catheter out. That was it was kind of nice having it in and not have to worry about going to the bathroom. Now I get to use a bottle instead.
Barely get any sleep. In the morning, she removes the catheter, and I mentioned again that I've passed out before. I don't know what this is going to be like. I don't know what to expect. Just to warn you. No problem. It shouldn't be anything. She removes the catheter, which honestly was, I didn't really feel anything at all. It was okay. I mean, I don't know what to expect. Would you know what to expect? So that's done. I'm good. She says now drink a ton of water because in about 6 to 8 hours I have to pee. It has to be done, otherwise they're gonna get a little worried that something's wrong. It's all this stuff they gotta go through. So you gotta pay attention to this. You gotta make sure you're drinking enough water so that you're actually gonna urinate, you know? I don't care if you're laughing your butt off right now. It doesn't matter. It's the point of the story. It is what it is. You kind of lose your dignity when you go into the hospital. The one doctor told me you'll get your dignity back when you go home. Yes and no.
Not too sure what I talked about. But as for day 3, my head hurts. My back feels okay. They've been giving me some muscle relaxers and those I think are helping with the spasms a lot. It feels sore. They took the bandage off so the stitches are exposed and you don't feel the tape pulling on your skin as much now. It's sore. Stuff tightens up.
So day 3, I don't really remember where this story would pick off and start. I mean, I made it through the night. Back spasms have gone down and such like that. But my headache is really bugging the heck out of me.
My head's just killing me more than anything. The one nurse said it might just be because of lack of caffeine, which makes sense. I mean, I tried to dwindle it down before coming to surgery a week before or so, but obviously that didn't help. When my head hurts like this, I don't want to do anything. I haven't watched TV at all. I barely want to eat. I just want to close my eyes and put a washcloth on my head, you know?
I mean, like, my head hurts more than anything, and it's taking me out of the game more than anything. I can't think straight. I can't do anything. All I want to do is close my eyes, put a cold compress on me, and just try to sleep, but it's not happening. And my favorite nurse comes in, start talking and all that stuff. And she mentions, well, do you drink a lot of coffee? And I'm explaining, yeah, I do drink a lot of coffee. I tried to wean it down before surgery because I didn't want to have that caffeine withdrawal, you know, but apparently I didn't do enough, but it could be other things combined with it. It probably was a combination of things between passing out and all that stuff and the anesthesia and all this. So at some point in the day, I cannot take any more Tylenol and whatever other medicine they were giving me for my head. It was like at the max. She tells me this, and I can't remember if they give me more medicine at that time or not, but at some point they disconnect my IV. My pain meds are disconnected. I don't have that anymore. That might have been done at like the night of day 2. I don't really remember, in all honesty. So I'm not connected to the IV. I still have the IV in my hand, but I'm not connected. She said they leave the IV in there just in case something happens, and you know, it's there if we need it. So that's cool, that's fine. My headache's still there and all that stuff. Catheter's removed, we're good to go. Now my favorite nurse comes in. So the other one was like my second favorite. This one's my favorite. Whatever reason is more personable, I don't know what it is. I let the new nurse, my favorite nurse, know that I actually passed gas, haven't peed yet, they took the catheter out, been drinking and all that stuff, and then at some point, she had just given me medication. It might have been the last dose of medication that I could actually get, and not long after that, oh man, so there's no catheter. So what they give you is a pee bottle. and they kind of just hung the pee bottle on the side of the bed rail. And I'm not feeling good. I'm like, I know I'm gonna puke. I know I'm gonna. It's coming. It's coming. So I roll over on my side, and I'm looking for something because I don't want to make a mess. I'm looking for the call button. I hit the call button. It's coming. It's too late. It's gone. I grab the pee bottle, and I puked 3 times in the pee bottle. Whatever, it was handy, but what are you gonna do? On the call button, the nurses are like, what can we help you with? I can't say anything, I'm busy puking. They probably hear me puking through the intercom system. They come in, I finish. She's like, what can we help you with? I'm like, I'm sorry, I just puked in my pee bottle. So she goes and washes that out for me and all that stuff. And then afterwards, she mentioned that she looked in my puke for the pills because they have to know if they can give me more medication or not. If they see the pills in there, they know they can give me more. If they don't see the pills, they can't give me any more. They don't want you overdosing on something, and it makes sense. So no pills in there, that's good. My medication's still in me. I'm still good for a while. So at this point in the day, my wife's there and such, and the nurse comes in the room and says, you know what, you've taken as much medication as you can for your headache as it is. You can't take any more. We're going to try something different. The doctor ordered magnesium for you. It goes to your IV, and we'll try this and see if it works. So she hooks up everything to my IV. She said it's a slow drip. It takes about 2 hours or so. And when she's done doing everything, I'm like, you know what? I don't know what it is, but I haven't had an issue with my IV at all yet, but this kind of hurts. It doesn't feel right. And she said, well, you haven't had the IV, you haven't had anything dripping through the IV for quite some time. The blood could have kind of clotted in there, so it might just be something like that. I'm like, okay, well, all right, that makes sense. So IV's going for, I don't know, maybe an hour or so, and then X-ray comes. So X-rays, or transport comes to take me to X-ray. So he's getting everything ready, disconnecting everything like that, and my hand just hurts. You know, it doesn't feel right, and when he's tugging on the IV and such, I can really feel it. It's not pleasant. So whatever, I get through X-ray, and it's the same one or I get through transport. It's the same one that took me, or tried to take me the other time. They get me in the chair, wheels me down to X-ray. I let them know, hey, you know what? I like to pass out a lot, so I don't know how I'm going to do. I was pretty good getting down here, but when they tried to get me in the wheelchair the other day, I passed out. All the same stories, I keep repeating myself. Just because I don't want to fall. I don't want anything to happen. You know, I don't know who's equipped to deal with what. I don't know if the X-ray tech is equipped to deal with somebody passing out. You know, I mean, so I'm just warning everybody. They get me onto the X-ray table, lay on my back, take the X-ray, lay on my side, take the X-ray. And of course, I had to ask them, you know, is there any way I can see the X-ray, see what's in my back, take a picture of it or something? No, it's not film anymore. It's all digital, and you're not gonna be able to go back there and see it. So there's really no way for you to do that. All right, I understand. So the X-ray techs weren't the most gentle in getting me back into the wheelchair. I mean, I got myself back in the wheelchair, but they put this blanket on you because the hallways are cold. And like the blanket's getting stuck in my IV, and she's putting it, it's tugging on everything. I'm like, oh man, this thing, my hand's really sore. Something doesn't feel right. Transport takes me back up to my room. By that time, dinner comes. My wife left when I was going down to X-ray, so I'm there by myself. Dinner arrives like 2 minutes later. I'm eating dinner. The nurse had come in just before that. She hooked the IV back up so I can get the rest of my meds, the rest of my magnesium. Eating dinner, I'm like, my hand really hurts. I'm looking, I'm like, does that look puffy? I think it's puffy. Put my hand back on, eating dinner a little bit more. I'm like, something's not right. It's starting to get red. Press the call button. My favorite nurse comes back in and kind of say, you know, my hand doesn't feel right, and I think it's a little puffy too. She looks at it and she's like, yeah, that's not supposed to be that way. I'm like, it almost feels like I just had a TB test or something. It's like all the stuff you're giving me through the IV is just kind of going underneath my skin instead of into my vein. And like, it'll absorb either way, right? It'll absorb either way, but it's not supposed to be that way. So then she's got to put a new IV in my like forearm here before she takes out the old one. So she does that. Didn't pass out, so that's a plus. Takes the old one out, and my hand's just like completely swollen, and it hurts, and I can't move my fingers or anything like that, just because it's like, come on, what next? So I got the new IV, got the rest of the meds going in, maybe 15 more minutes or something like that with the rest of the meds. Those were done. Eat my dinner. Actually ate all my dinner, so my appetite's starting to pick up. So things are looking good. And that's pretty much the end of day 3. Nothing much else happened, aside from the normal vital checkups and medication and stuff like that, just like normal with the other ones. Slept a little bit better, but not really, because I swear there was a lot more patients on the floor now, and like across the hall. It sounded like it was happy hour out there, so I barely got any sleep. And then the shift changes for the nurses are always a lot louder too, because they're talking about, oh, this patient this patient that, that's a new patient. It's a lot of chatter. So I had them close my door a couple more times and such like that than usual. And it got a lot hotter in my room and stuff. It was just little things that were uncomfortable. My headache was getting better though, so that was a plus. Come around to day 4. Get out of here. You made it to the end of day 3. So you went through day 1, day 2, and now day 3. If you've noticed, the length of the videos got just a little bit, I would say like what, a third shorter or a quarter shorter on each one. So I didn't do the math. But either way, check out day 4. I'll see you there.